Hi, my name is Joshua.
My name is Bobby, and we are third-year nursing students from Ryerson.
In this video, we're going to be covering the topic of polypharmacy, what it is, and how it's relevant in a long-term care environment. Additionally, we're going to be covering the topic of advocacy, how that ties into polypharmacy, and how you as a member of the healthcare team can advocate for the residents here at UHALM.
Polypharmacy is defined as the multiple uses of medications in a day, specifically 5 or more daily medications or unwanted medication use.
So why does this matter exactly, and why is it relevant to you as a member of the healthcare team here at UHALM? To begin with, elderly populations are more at risk for adverse drug reactions, or ADRs, as we will be referring to them throughout the rest of this video. Adverse drug reactions are harmful or unwanted drug interactions caused by medications. With age, our body naturally loses its ability to clear the drugs from our system, and with this reduced drug clearance, causes an increased risk for adverse drug reactions taking place. This is especially important for the older residents here at UHALM, where they are more at risk for the medications they are taking adversely affecting their own health.
Another prevalent issue in long-term care homes and among the elderly population as a whole is the risk of falls. Falls can be fatal, especially for seniors, because it can lead to morbidity and sometimes even mortality. Studies have shown a positive correlation between the increased amount of medications taken and the number of falls reported. Specifically, a study done on an elderly population with dementia and a history of falls showed that there was an increased prevalence of polypharmacy.
With aging arises some normal symptoms, such as being more tired, feeling more sleepy, having a decreased level of alertness, and episodes of feeling weak or dizzy. These symptoms are very similar to some side effects of some medications, and sometimes the side effects of medications can be misinterpreted as normal signs of aging. This can lead to more medications being prescribed to address the symptoms caused by the other medications. This is what's called a prescribing cascade. This can lead to polypharmacy, and as I previously mentioned, older populations are more at risk for adverse drug reactions. So the more medications they're taking, the higher their risk of these adverse drug reactions taking place.
In general, the amount of adverse drug reactions increases exponentially as the amount of medications being taken increases. Studies have shown that in nursing homes, residents taking 9 or more daily medications had double the amount of adverse drug reactions compared to those who were taking less medications. So now that we have gone over a little bit about polypharmacy, adverse drug reactions, and its relation to the elderly population, we will now move on to the topic of advocacy.
As a nurse, one of the many responsibilities you have on behalf of the resident is to advocate to the rest of the healthcare team about their needs and issues. One way you can demonstrate advocacy is by defending the residents' rights.
The residents may have many issues and may not be able to speak for themselves or be aware of these issues, so it is up to you as a member of the healthcare team to be the voice of the resident.
The key aspect to advocacy is raising awareness of any issues you feel are important. You can raise awareness by discussing with fellow pharmacists, physicians, or even another nurse. The main issue with polypharmacy is that it isn't being advocated enough. So, as we previously discussed, there are many issues and harmful side effects that polypharmacy has on the residents, which is why it's especially important to advocate about the issue of polypharmacy to the rest of the healthcare system.
Advocacy can come in many different forms. For example, understanding the patient's conditions. There are many patients who are on end-of-life care or palliative care, and they may not be able to be aware of their issues, so it is up to you, based on your assessments, to report any findings or issues that the resident may have to the rest of the healthcare team. Another form of advocacy is showing compassion. Being physically close to the resident, listening, and having eye contact are all ways you can show that you are really there for the resident in their times of need. Another form of advocacy is feeling as if you are one with the patient, or unity. If you feel as if you are one with the resident, then it makes it ultimately more natural and easy to speak on their behalf because you're understanding their issues a lot better. And also, the last form of advocacy that I will be sharing is protecting the residents by taking care of them. when you're protecting them by taking care of them. For example, if you are helping them with their activities of daily living, you can report any specific care routines or any specific needs that that specific resident has.
So another way you can demonstrate advocacy is by prioritizing the resident's health. This is done by regularly assessing their status on a regular basis. By doing this, you get a very firm and developed understanding as to what the resident's regular health is. So if there are any deviations or any differences in health, you can raise these issues to the rest of the healthcare team. Another way you can demonstrate advocacy is by showing your commitment to providing care to the resident. Now, as a nurse or as a member of the healthcare team, you're always providing mainly physical care to the resident. But another way, and arguably even more important way you want to provide care as part of the healthcare team, is by caring for them mentally and emotionally. Especially during times such as a pandemic, where they may feel isolated and lonely, it is important to demonstrate advocacy by caring for them both in the emotional and mental aspect by, just like my colleague said, being close to them and being one with them. Another way, and the last way I'm going to talk about how you can demonstrate advocacy, is by protecting the residents' rights. This is done by you, a member of the healthcare team, speaking up and sharing your thoughts about issues or any unjust changes made to the healthcare plan of that resident. By speaking up and raising awareness about these issues, you are overall bringing light to things that may be harmful to the residents, and you can benefit their health in a greater way. So just to summarize, advocacy is about speaking up, sharing your thoughts, and discussing with the members of the healthcare team on behalf of the resident, in the end, to benefit the resident's health as a whole.
Now that we have talked a little bit about advocacy, we'll now move on to the topic of MedSafer. MedSafer is a program that was developed by physicians and researchers from the McGill University, and it shows promise to be effective in dealing with the problem of polypharmacy. It is a tool that provides rapid, evidence-based, and personalized screening of each resident's history and medications. It is a tool that will be used to help guide physicians and pharmacists to deal with effective medication deprescription.
MedSafer works by applying criteria from current literatures, geriatricians, palliative care doctors, and physicians in order to provide a comprehensive medical review of a resident's medication list and comorbidities. This allows the healthcare team to have an individualized and prioritized set of e-prescribing opportunities.
In conclusion, we went over the topics of what polypharmacy is, how you as a member of the healthcare team can advocate, and a little bit about the new MedSafer program.
To help supplement your learning, we have created an infographic that covers the same topics we discussed in the video. You can find the PDF attached in this same email down below.
Please open up our Google form and answer a 5-question quiz to test your knowledge on the topics that we went over in this video. We hope that you have learned something new and it can help improve your practice. Thank you for listening and have a great day.